My mom used to smoke. She says cigarettes kill.
Really? Now, is your mommy a doctor?
No.
A scientific researcher of some kind?
No.
Well, she doesn't exactly sound like a credible expert now, does she?
Most women do not know, in fact, the overwhelming majority of women do not know that lung cancer is the leading cause of cancer death in women.
When it comes to cancer, what do you think the leading cancer killer of women is?
I would say probably cervical cancer, because most women don't get tested for it.
It's either ovarian cancer or breast cancer.
Ovarian cancer.
I think it might be cervical cancer.
Lung cancer is the leading cause of cancer death in women, and 90% of those lung cancers are related to smoking.
When it comes to smoking, do you think it would be harder for a man or a woman to quit?
Harder for a woman. I've been trying to quit. I've quit before, and I think because of the stress levels, and I really think it's harder for a woman.
Right now in the United States, slightly more men smoke than women. But one of the big differences is that fewer women have quit over the decades since the Surgeon General's report, the first one in the early 60s, on smoking and health. Many more men have successfully quit than have women.
Most doctors don't recognize that heart disease remains the biggest killer of women. You know, if you get a woman in her 50s or 60s and she's always worried about her husband, always pestering her husband to go see the doctor, not thinking about herself as much, and she just starts to have a few days of feeling tired, just feeling generally tired, or having maybe what she thinks is indigestion after a meal or something like that, and she doesn't worry about it. Well, she's missing a critical window here to actually get something done.
What are the symptoms of a heart attack? Oh, good heavens. Pain, numbness in the arm, shortness of breath.
Sweating, tingling in the neck.
I think they're similar in men and women.
A pain in the left arm, sweating.
For women or men?
For women.
It's actually cold and flu-like symptoms. I start to feel a little sick. It's not that whole left arm thing.
You know, we still have the sort of Hollywood heart attack mentality. You expect someone to come in sort of clutching their chest and having classic symptoms. And we know, first of all, that's rarely the case. And second of all, women are probably even more so affected than men by it.
I think we should all be in clinical trials. We have a moral obligation. Fortunately, I've never been asked, but I take so many drugs anyhow. I am a clinical trial.
What is a clinical trial?
I can't remember, but I did see something about it on TV.
I don't know what a clinical trial is. They just do a study of people with the disease over a few years.
Different medications to see what are the side effects, adverse effects.
You go through the FDA and it's a black hole from there. I have no idea.
So do you think that women are included in clinical trials? I believe so. They would be.
As far as I know, I've never been to one, but I've read them. You know, you read about the advertisements.
Would it surprise you to learn it's 1993?
It's a long time. Yeah, we should have started sooner.
So they were using them on women, but only testing them on men before 93? Okay, that's kind of odd.
You would think that because trials have been going on for such a long time that they want a fair representation of the general population, and women should have been included earlier.
The reason pharmaceutical companies primarily tested on white males were that it was easier. Didn't have to worry about pregnancy, didn't have to worry about menstrual cycles. White men tended to volunteer for clinical research, while women and minorities tended not to, and still tend not to.
One of my partners, who incidentally is now an OBGYN at NIH, Dr. Alan DeCherney, was in this aspirin study. And I wanted to be in the aspirin study. I mean, you know, if your partner's in it, you want to be in it, you know. So they said, oh, women weren't included. and they were giving some of the men aspirin, and some of the men were not getting aspirin. And I, of course, felt that it was important that I be in the study, and I was not allowed in the study because I was a female. And that sort of stuck in my brain. And it turned out it stuck in the brain of a lot of women who were then starting to enter the academic fields.
Let's imagine this. There's a whole class of medications that are used as osteoporosis prevention and treatments. Several of them were known to be very effective when given to men. But we found out when we gave them to women that it made their uterus fall out. Imagine if we never gave it to women until it was on the market. Pretty strange.
I think that what the man in the street is reflecting is a lack of knowledge because there is a lack of education.
There are all these things that are starting to emerge, and the only way we're going to continue to learn about them is to do the studies, to do the research.
Having a sex difference helps you because it's another tool.
Women need to understand that without their pioneering participation in clinical research trials, there aren't going to be new products and new therapies for them and their daughters and for future generations of women.
Well, we've made a lot of progress. We understand now that there are sex differences, and these sex differences are important to understand the mechanisms of disease. And we need to continue this research because it's so important to all of us. And one day, hopefully, in the not-too-distant future, we'll know what the differences are and what the appropriate treatments should be for men and women, for different ethnic communities, and for different age groups. And that's why the work of the Society for Women's Health Research is so important.